Good afternoon, my name's Squadron leader Liz Paxman. I'll be presenting on COVID-19 transfers in London. I was deployed as part of a MAPA request and military aid to a civilian authority. Request was done by the London Ambulance Service April earlier this year. And the request was to help facilitate critical care transfers from hospitals in London, predominantly to the NHS Nightingale facility. The Nightingale facility is a hospital that was put together in the Excel Conferencing Centre. The request was for 2 weeks, and personnel, military personnel was sought from a pre-hospital care background, so not critical care. And the reason for that is because actually the critical care military personnel were obviously very much deployed in within their own area. Next slide, please. In my career to date, I've been a qualified nurse since 2004, worked predominantly within the NHS setting before joining the Royal Air Force in 2008. Completed various tours with the Medical Emergency Response Team in Afghanistan and in Kenya with numerous exercises. And in between deploying, I work in the emergency department and with the ambulance service, which is where I am today, just finishing off my shift as an advanced clinical practitioner. I'm also a PhD student at Southampton University researching advanced roles for nurses and paramedics. So as you can see, my intensive care background is very limited. I've never formally worked in an intensive care unit. However, my pre-hospital experience, we are used to transferring critically unwell patients, so it felt that actually it was going to be the best fit. And certainly during COVID, the requirement for nurses and doctors and other medical personnel to be redeployed into critical care was demanded, and actually we did have to do it. And a lot of nurses and various other medical professionals did have to work in different areas as part of the COVID-19 response. Next slide, please. So this is the tasking. We've got 10 teams. So each team consisted of a consultant, emergency medicine doctor or anaesthetist, paired with either a nurse or paramedic. And we had 9 pre-hospital nurses and 1 paramedic. So this is all of the people that deployed for that detachment. Next slide, please. So on arrival into London, the first thing we needed to do was conduct some training. So we did some team training with people that we were paired with, did some equipment training, so learning how to use inline suction and the ventilator and troubleshooting ventilator strategies, using the monitor to do invasive monitoring, brawn perfusers, donning and doffing of personal protective equipment, and the tour of the NHS Nightingale facility itself. We also did ambulance familiarisation and also did some drills on what to do in an emergency, for example, an accidental extubation of a patient or falling end tidal CO2, high peak pressures. So we did some simulation training with that, and that was all achieved in 2 days. Next slide, please. So this is the equipment that we carried. This is all military equipment. So we've got our brand new ventilator, the EVTR ventilator, very sophisticated, really useful for these transfers. And with brawn perfusers, and we also use the Tempest Pro, really nice and light piece of equipment. And then we did some simulation work as well, bringing it all together. Next slide, please. So every shift, this is all of the equipment that we would take on each mission. So everything was fully checked every time. Making sure we've got enough PPE, making sure the ambulances are good to go, that we've got enough fuel, plenty of oxygen, and making sure that we've got all of our communication devices such as radio and mobile phone. Next slide, please. So this is Lieutenant Colonel Walker, an emergency medicine consultant who I was paired with. I've previously deployed with him in Afghanistan, and I work with him in the emergency department in Oxford. So we've got a pretty good working relationship, which I think is fundamental for doing these transfers. They are particularly stressful and are quite a challenge, and actually it's important that you've got a good working relationship and a team approach with the person that you're paired with. Next slide. So this is the door in which we delivered patients to. So with all the training completed, 10 teams signed on, ready to go to receive referrals for transfers into the Nightingale facility or other transfers to other hospitals, for example, patients that might need some dialysis, so we take them to different hospitals for that. but most of our transfers went into the NHS Nightingale in London. So we got referrals pretty quickly once we'd signed on, and they need to fit a strict acceptance criteria for the hospital. When we arrived at the hospitals that we went to collect the patients from, it was quite interesting. We weren't often in intensive care units. We were often in different wards that had been made very quickly into intensive care units. These patients weren't necessarily looked after by critical care nurses, like there would normally be one-to-one nurse. There may be a different ratio of nurses that probably wasn't from a critical care background. It was a very hot environment, very busy. All the beds were pretty much full, and you could see that actually these hospitals needed decompression pretty quickly. So there are different working practices, so each hospital worked very differently, so it's really important that we got good communication, good handover at the beginning. Next slide, please. So once the patients transferred them, we met at the front door of the NHS Nightingale, and it's quite an interesting slide because the people in the blue scrubs that you can see that we're handing over to, often they're porters, and those porters weren't necessarily from a medical background. In fact, some of them actually worked in Heathrow Airport as baggage handlers, and they found that obviously during the COVID-19 that they were not working in Heathrow, and so they volunteered to work within NHS Nightingale and really step up to the COVID-19 response. So that was quite interesting. Next slide, please. So after each mission, which typically lasted between 4 to 5 hours, so in that PPE, which I'm sure in your own country is sadly not uncommon for a long time, that actually it's really important that when you do take the PPE off, it's strictly supervised and done in a stepwise approach. So you can see one of the London Ambulance Service paramedics making sure that it's all done slowly and safely to make sure nobody's exposed to any COVID. And after each job, make sure you're fully refreshed and rested, and then would be debriefed fully in order to learn lessons so that we could keep improving our practices for each transfers as we went along. Next slide, please. So some reflections. We did just over 50 transfers in the 2 weeks that we were there. Some of the things that I found interesting is that actually it was absolutely essential to do a full top-to-toe assessment of the patient. A lot of things change, and they may have been referred in the morning, but actually they were maybe outside of the acceptance criteria. COVID-19 patients with significant complications do change regularly and become unwell. So actually the transfers are never that stable. So having a full thorough assessment is vital. Checking batteries of everything, batteries on the stretcher, on all the equipment, and making sure you've got backup and another backup. Communication is very difficult in the PPE, and one of the things we found quite on our first transfer is actually we didn't, nobody knew who we were, and so we quickly got some stickers printed with like our name and our role, so like Liz, nurse, on the front, so that people would know who we were. Electronic records are probably going to be the way of the future. Like when we were given photocopied notes in a COVID environment, they are obviously still contaminated. And I think it's a lonely place in the back of an ambulance. Well, it is a lonely place in the back of an ambulance when patients become unwell and get worse. And actually, it's really difficult in PPE to try and manage some of those challenges. But having a really good team relationship with the doctor that I work with made that go a lot smoothly. But in addition, it's always useful to have your mobile phone in a plastic bag, ready to call a friend should you need to. Next slide, please. So all in all, it was massively rewarding experience to be part of the COVID-19 response and work in London. Hugely rewarding, and I learned a lot that I'm going to be able to bring into my own practice and my pre-hospital practice on conducting critical care transfers. Thank you very much for listening, and thank you for the invitation to present. Please feel free to contact me on my email or my Twitter handle, as you see on the slide. Thanks again.